Welcome to Medical-Junction. Today we are going to learn something about the liver cirrhosis. In this video we will discuss about the overview, cause, formation, diagnosis and treatment of this serious condition. So let's start. Liver is a vital organ in our body located in the right upper quadrant of the abdomen below the diaphragm. It plays a vital role in synthesis of proteins like albumin, clotting factors and complement, etc. Detoxification and storage is another function of the liver, and in addition it participates in the metabolism of lipids and carbohydrates. Cirrhosis is a condition in which the liver does not function properly due to long-term damage. This damage is characterized by the replacement of normal liver tissue by scar tissue. Okay, now come to the cause. Liver cirrhosis has many possible causes. Sometimes more than one cause is present in the same person. Globally, 57% of cirrhosis is attributable to either hepatitis B or hepatitis C. Alcohol consumption is another major cause, accounting for about 20% of the cases. We will discuss about the ALD and NALD in another video. So for now, we will continue to pathophysiology. When the liver cells are damaged, they start to come together and form the regenerative nodules. These are the colonies of living liver cells, and this is the classic sign of cirrhosis, for which the liver is bumpy rather than the healthy one, which is smooth and not bumpy. Other than this, you can see the fibrotic tissue in between the regenerative nodules. So what happens in this case? Let's discuss about it. The pathological hallmark of cirrhosis is the development of scar tissue that replaces the normal parenchyma. You can already see the difference here. Alright, so how the scar tissue is formed? A recent study shows that a special cell called the stellate cell, which lies in between the sinusoids and hepatocytes, that is in the perisinusoidal spaces, has a pivot role in the development of cirrhosis. It normally stores vitamin A and holds there in quiescent stage or sort of dormant stage. When the hepatocytes are damaged, they release paracrine factors that activates the stellate cells. These activated stellate cells secrete TGF-beta, which leads to a fibrotic response and proliferation of connective tissue. Furthermore, it secretes TIMP1 and TIMP2, naturally occurring inhibitors of matrix metalloproteinases, which prevents them from breaking down the fibrotic material in the extracellular matrix. And finally, it forms the scar tissue, where in normal condition, this stellate cell functioning as a wound healing process, but due to constant injury process, stellate cell constantly activated and produces large amount of collagen and factors that leads to fibrosis. As this cascade of process continues, fibrous tissue bands separate hepatic nodules, which eventually replaces the entire liver architecture. And this is when the complication starts in. As the central vein in the sinusoids become compressed by the huge amount of fibrotic tissue in the perisinusoidal space, there is a pressure start to build up in the sinusoids and responsible for the most severe complications of cirrhosis, that is portal hypertension. And this causes extravasation of fluid in the peritoneal cavity and leads to ascites. The spleen becomes congested due to back pressure, which leads to hypersplenenism. And in the same way, the circulatory system diverting blood away from the liver due to high pressure in portal vein. This known as portal systemic shunt. This exchange ultimately triggers renal vasoconstriction, which decreases renal blood flow, which leads to low filtration of kidney and responsible for renal failure follows liver failure. Pressure buildup and diversion of blood essentially reduces the functionality of sinusoidal vein and a number of portal triads in general. As there is lesser functionality of liver occurs, it fails to do its job like in detoxification of blood. The toxins then accumulated in brain tissue and cause mental deficiency known as hepatic encephalopathy. Although there are several neurotoxins that are thought to contribute in development of hepatic encephalopathy, the best understood factor is ammonia, which is produced in the GI tract, and liver helps to prevent the mixing of ammonia in systemic circulation. This toxin product ammonia cause huge amount of damage in lesser amount, and patient might develop asterixis where they have tremoring or jerky hands when they outstretched. When there is more toxin buildup, patient may eventually progress to coma. Also, liver plays a big role in the metabolism of estrogen into inactivated metabolites. Patient can also experience complications due to increased estrogen level in blood like gynecomastia, spider angiomata, and Palmer erythema. Liver also fails to regulate bilirubin metabolism, which results into increased unconjugated bilirubin in blood, and it can lead to jaundice or icterus in newborn. Bruising and bleeding resulting from the decreased production of coagulation factors, and there is also several coagulation issues occur during any injury. Esophageal varices also results from the dilation of the superficial veins lining the esophageal mucosa due to portal hypertension. Caput medusa are dilated periumbilical collateral veins due to portal hypertension. So, now we will recap the general symptoms of cirrhosis. In early stage, there is a small fibrosis occurs. We call it compensated cirrhosis, as there is no systemic episodes are seen, and in this stage, liver can also do its job normally. But in later stage, when there is extensive cirrhosis occurs, we call it compensated cirrhosis, and it can't function normally. At this stage, there is lot of described symptoms developed like jaundice, pruritus due to bilirubin deposition under skin mucosa, ascites, hepatic encephalopathy, easy bruising, etc. The gold standard for diagnosis of cirrhosis is a liver biopsy through a percutaneous, transjugular, laparoscopic or fine needle approach. A biopsy is not necessary if the clinical, laboratory or radiological data suggest cirrhosis. Common lab findings include elevated serum bilirubin, elevated enzymes like ALT, AST, where AST is usually more elevated than ALT, and there might also be thrombocytopenia. Albumin level fall as the synthetic function of the liver declines with worsening cirrhosis, since albumin is exclusively synthesized in the liver. Prothrombin time increases since the liver synthesizes clotting factors. Globulins increased due to shunting of bacterial antigens away from the liver to lymphoid tissue. Ultrasound is routinely used in the evaluation of cirrhosis. It may show a small and nodular liver in advanced cirrhosis along with increased echogenicity with irregular appearing areas. Gastroscopy is performed in patients with established cirrhosis to exclude the possibility of esophageal varices. The severity of cirrhosis is commonly classified with the Child-Pugh score. This scoring system uses bilirubin, albumin, INR, the presence and severity of ascites and encephalopathy to classify patients into class A, B or C. Class A has a favorable prognosis, while class C is at high risk of death. More modern score used in the allocation of liver transplants but also in other contexts are the model for end-stage liver disease score. Okay, now come to the treatment. As in treatment, the cirrhosis is irreversible. So first of all, it is important to prevent the liver damage by identifying the underlying cause. For example, stopping alcohol consumption. Vaccination of susceptible patients should be considered for hepatitis A and hepatitis B. Treating the cause of cirrhosis prevents the further damage. For example, giving oral antivirals such as entecavir and tenofovir in patients of cirrhosis due to hepatitis B prevents progression of cirrhosis. In advanced cirrhosis, if the liver stops functioning, liver transplant might be needed. In the United States, the MELD score is used to prioritize patients for liver transplantation. People with decompensated cirrhosis generally require admission to a hospital with close monitoring of the fluid balance, mental status, and emphasis on adequate nutrition and medical treatment. As liver cirrhosis is a large topic, it is not possible to put all the details in one session, I have tried to gist all the important points of liver cirrhosis in this video, but I do refer to follow any textbook on this topic. You can also find a link of an article of this video in the description below. Do like and follow us for more upcoming videos. Thank you.